Hi, I'm Dr. Rajsree Nambudripad. I'm board certified in internal medicine, and today I'm going to talk all about hair loss. Don't we all love our hair? Actually, having beautiful hair is a sign of good health. It also influences our self-esteem and our confidence. That's why losing hair can be quite scary, and I see patients every day who are worried about their hair loss. What's the root cause of hair loss? I like to think of hair loss as an outward sign of an inner imbalance in the body. Basically, your body's trying to tell you something. This is a diagram I made that summarizes some of the most common causes of hair loss that I see in my practice. If you suffer from a thyroid condition, either too high thyroid or too low thyroid, this can cause hair loss. A big shift in hormones can also trigger hair loss. Stress is actually a major cause of hair loss. If you're reacting to chemicals from the environment or hair products, this can cause hair loss. Autoimmune disease is another big root cause of hair loss. Having high levels of the hormone dihydrotestosterone or DHT can cause hair loss in both men and women. If there's inflammation in your body, this could trigger hair loss. Low stomach acid is another commonly overlooked cause of hair loss. If you're not getting enough protein in your diet, or if you suffer from low iron stores, this could be a root cause of your hair loss. If you see hair on your comb or your brush, don't panic. It's actually normal to shed up to 100 strands of hair per day. Let's learn a little bit about the hair growth cycle. The majority of your hair is in the anagen phase, which is the active growing phase of hair, and can last from 2 to 6 years. Depending on your hormones, nutritional status, and stress level, your hair will decide when it wants to transition to the catagen phase. This is when your hair stops growing and detaches itself from the nourishing blood supply. This phase can last up to 3 weeks. The final and dreaded phase of the hair cycle is the telogen phase. So this is a 3-month period where your hair prepares to shed. The good news is after the hair sheds, a new hair follicle will take its place, and we go back to the anagen phase of hair growth. Remember the final and dreaded phase of the hair growth cycle called the telogen phase? Well, there's something called telogen effluvium. This is when a big stress on your body causes a lot of your hair follicles to transition early to the telogen phase. This is bad news for your hair because the telogen phase is when your hair prepares to fall out. In telogen effluvium, up to 30% of your hair stops growing due to the stress, and 2 to 4 months after the stressful event, you'll notice an accelerated phase of hair loss. The bad news is you may lose up to 300 or more hairs per day. Oh no, this poor lady looks completely stressed out. This cannot be good for her hair. So these are the most common causes of telogen effluvium. They include emotional stress, surgery, high fever or illness, extreme weight loss, or big hormonal shifts. Here's the good news for telogen effluvium. The hair will grow back. It may take a while, maybe 6 months to a year, but it'll come back eventually. So it's a temporary condition, and there is no danger of complete baldness. So if you don't want stress to cause your hair to fall out, we have to figure out how to balance stress and relaxation. We all have our obligations, whether it's work, kids, taxes, bills, and this pandemic. That's why it's so important we balance our stress with things we enjoy, like going to the beach, taking a hot bath, sleeping, exercising, watching a relaxing movie, or reading a good book. What are some of your favorite ways to reduce stress? Do you enjoy meditation, cuddling with a pet, reading a good book, working out, or going to the beach? So beauty sleep is important for your hair. So the thyroid gland is the butterfly-shaped gland which is located in your neck, and it controls your metabolism and can also control your cycles of hair growth. I like to think of the thyroid hormones as the Goldilocks hormones, meaning they have to be just right. Hyperthyroidism is too much thyroid hormone, and hypothyroidism is too little thyroid hormone, and both of these can cause hair loss. Autoimmune disease of the thyroid gland could also affect your hair. Hashimoto's thyroid disease is extremely common, so I like to screen my patients for this. It's diagnosed by the presence of the thyroid peroxidase antibody, which can trigger inflammation in the thyroid gland and lead to hypothyroidism. Graves' disease is less common, but it is an autoimmune cause for hyperthyroidism and is diagnosed by the presence of the thyroid-stimulating immunoglobulins. The thyroid gland produces T4, which has to be converted to T3, which is the active form of thyroid hormone. Depending on your symptoms and your lab values, we can figure out which thyroid medication would be optimal for your condition. Having low iron stores is one of the main causes of hair loss I see in my practice. A lot of young women suffer from heavy periods, and this can deplete their iron stores. It can also be a root cause of fatigue, cold intolerance, restless leg syndrome, and brittle nails. On your blood work, iron stores is called ferritin, so we want to get your ferritin up to 90 to 110 for optimal hair growth. Foods that are rich sources of iron include red meat, dark meat chicken, salmon, leafy green vegetables, lentils, as well as dark chocolate. In many cases, we have to use additional iron supplements, and I always remind my patients to pair it with vitamin C, which is a cofactor for iron absorption. The most common side effect of iron is constipation, so it's best to start at a low dose and gradually increase the dose as tolerated. Another root cause of hair loss is not getting enough protein in your diet. Protein is extremely important for hair growth. The amount of protein you need depends on your physical activity, but on average, I typically recommend half a gram of protein per pound of your body weight. For example, if you weigh 150 pounds, you should aim for 75 grams of protein per day. If you're not reaching this goal through your diet, you can add a supplemental protein powder. One of the most popular types of protein powders for hair growth is collagen. Collagen has all the amino acids for hair growth, and it comes from the tendon or ligaments of cows. There's also marine collagen that comes from fish scales. A lot of my patients like to add this to their smoothie or blend it into their morning coffee. Another common cause of hair loss that's often overlooked is low stomach acid or hypochlorhydria. Normally, the parietal cells in the stomach secrete hydrochloric acid, which is really important to breaking down and properly digesting proteins in the diet. The problem is, as we get older, sometimes our hydrochloric acid production goes down. If this is the case, we will see elevated levels of protein on your stool test. Another common cause of low stomach acid is being on a proton pump inhibitor type medication, such as omeprazole, which is Prilosec. The good news is we can help your digestion by supplementing with digestive enzymes. Digestive enzymes are taken 1 to 2 capsules before meals and help you to better break down the food and assimilate the protein from your diet. We also find betaine hydrochloric acid and pepsin to be really helpful for protein digestion. Typically, I recommend this to patients where I suspect hypochlorhydria based on the protein level in their stool test. This should be taken during or after a meal to prevent any burning. For some patients, digestive enzymes and betaine and pepsin can make a world of difference for their hair growth. A shift in your hormone levels could also trigger hair loss. For example, during pregnancy, there's a big rise in hormone levels. So after delivery, when women are postpartum, they often notice a lot of hair loss due to the drop in the hormone levels. Another time of hair loss is the transition to menopause because of the drop in the estrogen and progesterone levels. Anytime there's a sudden change in your body composition or your weight, this can lead to hormonal changes that could trigger hair loss. The same thing is true in men. When a man goes through a significant illness or injury, this can shift their hormones, leading to hair loss. Sudden changes in the weight or body composition, for example in the case of athletic training, could also lead to hormone shifts that can affect hair growth. Next we have inflammation. So inflammation in the body is not good for hair growth. I like to help my patients figure out what's causing inflammation in their body. Is it insulin resistance? Could it be their inflammatory diet? Do they have leaky gut? Maybe they have a bacterial imbalance in their microbiome causing dysbiosis or small intestine bacterial overgrowth. Finally, maybe they have an infection with H. pylori bacteria or a parasite that's triggering inflammation beginning in the gut. One of the most common causes of inflammation that I see is insulin resistance. Insulin is the hormone your pancreas makes, telling your body to take up blood sugar. The problem in insulin resistance is your body's tissues ignore the insulin. A lot of times this is due to visceral fat, which is fat surrounding your internal organs. Sometimes it's also due to genetic factors. Insulin resistance is the physiology that can lead to prediabetes or diabetes. Because the tissues are ignoring insulin, the pancreas has to make higher levels of insulin, and insulin can make you hungry. It also makes you gain weight, store fat, and accelerates the aging process. Insulin resistance and fatty liver are often seen together, and both of these create inflammation in the body that's not good for hair growth. Is the inflammation coming from your diet? If these are the kinds of foods you're eating, it's probably causing inflammation in your body. In fact, the standard American diet, or the SAD diet, is actually quite inflammatory, and this could be bad for hair growth. The good news is if you're suffering from inflammation from the diet, or if you have insulin resistance or fatty liver disease, I can definitely give you guidance on how to change your diet. Let's switch you over to a clean, anti-inflammatory, organic diet, and let's see the improvement in your hair. Autoimmune diseases are also a big root cause of hair loss. If we see a round, circular patch of hair loss, it could be an autoimmune condition called alopecia areata. In this condition, your body's immune system attacks the hair follicles, causing the hair loss. We can also see hair loss in autoimmune conditions such as lupus, Hashimoto's thyroid disease, inflammatory bowel disease like Crohn's or ulcerative colitis, scleroderma, or rheumatoid arthritis. The good news is in integrative and functional medicine, everything we do to reduce inflammation in the body through diet, optimizing nutritional status, and reducing inflammation in the gut can help with the hair growth in autoimmune disease. Next, we have reaction to chemicals. So we're all bombarded by chemicals in the environment, whether it's the chlorine in the water, our hair products or hair dye, or heavy metals from the environment. If you're a patient going through chemotherapy or radiation, obviously that can affect your hair growth. Certain chemical straightening treatments, such as the Brazilian blowout or keratin treatments, may contain formaldehyde, so be sure to ask about this because it could affect your scalp and lead to hair loss. Finally, if you're exposed to mold damage in your home or your workplace, this could be bad for your overall health as well as your hair. Now let's talk about male pattern baldness, also known as androgenic alopecia. The hormone testosterone is converted to dihydrotestosterone, or DHT, by the enzyme 5-alpha reductase. High levels of DHT will cause male pattern baldness, and in women it can cause hair loss in the temporal areas. The good news is we can block the 5-alpha reductase enzyme using herbs such as saw palmetto. Saw palmetto is also protective on the prostate because high levels of DHT can cause prostate enlargement. There's also the prescription finasteride, but it does have some side effects, so we use it on a case-by-case basis. Some men have a strong genetic tendency towards male pattern baldness, so in these cases it can be hard to avoid. We're back to my original diagram, so we've gone full circle around all of these different causes of hair loss. But there is one that I left out, so I want to talk about that a little bit more. The final thing affecting your hair is genetic factors. How is the hair of your parents and grandparents as they got older? Do your brothers or sisters have any problems with hair loss? If you're scared and frustrated by your hair loss, don't panic. Let's figure it out. The first thing I do with my patients is take a detailed history, and then I examine their scalp. Are you thinning all over? Are there any round bald spots? Is there any redness or flaking? Then we run some comprehensive blood work to figure out what's the root cause of your hair loss. So we check the ferritin, which is your iron stores, and we check a full thyroid panel. So that's TSH, free T4, and free T3. Because Hashimoto's is so common, I like to test for it by checking the TPO antibody. Homocysteine is a marker telling me how well your body is methylating and detoxifying. It's also an inverse marker of your B vitamins, so lower the homocysteine the better. Vitamin D is incredibly important for your hormones, immune system, and all aspects of your health, so I definitely check vitamin D. I also like to check the female or male hormones, and if I see hair loss in the temporal area or male pattern baldness, I check the dihydrotestosterone. If I suspect autoimmune disease based on the scalp exam, or if the patient has a lot of joint pain, I'll check the ANA, SED rate, and CRP. I also remind my patients to stop any biotin supplements for 3 days prior to their blood work because it can interfere with the thyroid labs. The other thing I like to do in my practice is delve into the gut microbiome. A lot of the inflammation in your body begins in the gut, and the gut controls your absorption of nutrients, so hence it can have a significant impact on your hair. Through a comprehensive stool test, we can find out, is there an infection in your gut? For example, is there H. pylori, a parasite? Is there an imbalance in your bacterial profile called dysbiosis? Or is there an overgrowth of candida, which is a yeast? Do you have inflammation or leaky gut, also known as abnormal intestinal permeability? This can be a root cause of autoimmune inflammation in the body. How well are you absorbing nutrients from your diet? Is there elevation in fat or protein in your stool? If your pancreatic elastase is low in the stool, this could be a sign of EPI, which is exocrine pancreatic insufficiency. This means you're deficient in pancreatic enzymes, which could be causing malabsorption. Small intestine bacterial overgrowth is another big cause of malabsorption. Finally, are you recycling toxins from your gut? If you have an elevated beta-glucuronidase in your stool, this tells us you're recycling toxins as well as estrogens from your gut. All disease begins in the gut, and it's amazing how much we can learn about your health from a simple stool sample. Remember how stress can cause telogen effluvium and hair loss? Well, sometimes I like to test for the stress hormone known as cortisol using a saliva test. Cortisol is the stress hormone made by your adrenal glands. The nice thing with the saliva test is it allows you to submit several specimens of saliva from several points throughout the day, and then the lab can generate a graph showing us what's happening with your cortisol from morning until bedtime. As you can see here, this patient's cortisol is high throughout the day, so this could be a root cause of hair loss. The good news is once we diagnose this condition, we can treat it through lifestyle changes as well as certain supplements. Let's find the root cause of your hair loss. The great news is it's an opportunity to get healthier. We get to optimize your nutrition, reduce any inflammation we find in your body, balance your hormones, and heal your gut microbiome. Once we find the root cause, hair loss is often treatable. You may need to clean up your diet and take a couple supplements, but in the end, you feel so much better and we see improvement in hair growth. What I love about my practice in integrative medicine is patients are so proactive about their health. We can see such an improvement in health in just 3 to 6 months, and as the person gets healthier from the inside, their hair growth improves as well. Well, most of the time. Thanks so much for watching. Hope you enjoyed the video, and please share it with your friends and family. Please subscribe to my YouTube channel, and I want to thank all of my YouTube subscribers. You can also follow me on Instagram and Facebook to get updates on a variety of health topics. Thank you again, and I wish you all great health and beautiful hair.